Hi everyone. Good morning or good afternoon. Hi. So we're going to talk to Dr. Terry Wahls today. Amazing, Dr. Terry, about autoimmune disease, mainly multiple sclerosis, her journey and her work, research, and everything, all the details. If you have any questions, do not hesitate to type in the comment or down in the question box so we can go through those questions. Okay, just a second, and I'm going to. Good morning. Hi.
Good morning. So wonderful to be here with you.
Thank you. Thanks for being here. Great to see you. So, Dr. Terry, I'm going to ask a few questions. First of all, we see about 40% at least seeing more and more incidents of multiple sclerosis, autoimmune disease in North America,
Yes.
United States, and this looks very significant number. And why is that? Why we have such an increase in? Is it because we diagnose more people now, or is it because
there are multiple factors here. One is that our diets continue to get worse and worse every year. More added sugar, more white flour-based food. So that 60 to 75% of our calories are from either sugars, or white flours, processed foods. So that's crowding out the nutrition we need to, run the biology of life properly. So that's problem number one. Problem number two has to do with, excuse me, the recent pandemic. We know that previous infections are one of the steps. You have the genetic vulnerability, then an infection. And Epstein-Barr virus is one of the microbes, but so is coronavirus. So are 16 other microbes that are involved in increasing the risk for an autoimmune disease. And then, collectively, we all went through enormous stress in 2020, 2021, 2022, from all of the upheaval that happened as a result of the pandemic. So those three factors will drive the increase in anxiety, depression, high blood pressure, metabolic syndrome, that's insulin resistance, and the development of autoimmunity. So that increases the burden of complex chronic diseases. And for those of us with an autoimmune disease, it increases the probability of also developing a comorbid complication such as anxiety, depression, insulin resistance, premature menopause, metabolic syndrome, worsening obesity, worsening prediabetes, and type 2 diabetes.
Yes. So we hear your story about yourself having multiple sclerosis and also severe pain due to trigeminal neuralgia. If you don't want to share a little bit of your story with everyone here.
Yeah. So I'm an internal medicine physician. Everything was going great. I had a couple of kids. I had a partner. And then, back in 2000, I was out walking with Jackie, and half a mile from home, my left leg grows weak, dragging it, I hobble home. And I see the neurologist and begin the workup. It takes about 3 weeks. And I'm eventually diagnosed with relapsing remitting multiple sclerosis. I have one lesion in my cervical cord, one in my brain, and abnormal spinal fluid. By that time, I've already had 20 years of worsening trigeminal neuralgia. So I'm like, God, this is going to be really terrible. I clearly have a progressive neurologic problem. I do my research, find the best MS center in the country, excuse me, take the newest drugs, but I continue to decline. And 3 years later, 2003, I'm in a tilt recline wheelchair. It's getting harder and harder to sit up, harder to walk. Fortunately, my mind is clear. And I began asking myself, am I doing all that I can? What I'll decide is that I'm going to go back to reading the basic science. And I'm reading about the basic science models of many neurologic diseases. And I see that mitochondrial dysfunction is a big driver. So I create a supplement cocktail for my mitochondria, which does help my fatigue a little bit. Yeah, and I'm super grateful because fatigue is a really crushing problem. But I continue to decline, although a little bit more slowly. I discover a study using electrical stimulation of muscles in people who are paralyzed, who are never going to walk again. I talk to my physical therapist. He agrees to give me a test session. And it hurts a lot. But when it's over, I feel great. And I begin doing electrical stimulation of my muscles, thinking that it may not help how I walk, but we're adding it to my physical therapy. Then I discovered the Institute for Functional Medicine, and I take their course in neuroprotection. I have a longer list of supplements, which I add. And then I have this really big aha. I sort of laugh at myself that took this long to have this aha. You know, what if I redesign my Paleolithic diet that I've been already following for 5 years based on this long list of nutrients I'm taking in pill form? So that's a few more months of research. I get this all sorted out. And I start this new way of eating, a very structured Paleolithic diet, December 26, 2007. Now at that time, I cannot sit up in a regular chair like I am now. I'm in a zero gravity chair with my knees higher than my nose. I can take a couple steps using 2 walking sticks. I begin to have brain fog. My trigeminal neuralgia has clearly been getting progressively more severe, much more difficult to control. So it's very clear to me that I'm on track to become bedridden by my illness, demented by my illness, and possibly die with intractable, horrific levels of pain. I have a son, 16, a daughter, 13. And that's when I start this new way of eating. A month later, it's clear that my fatigue is less, my brain fog is less, and my pain is better controlled. And my physical therapist says, Terry, let's advance your exercises. I think you can do 10 minutes twice a day now. That's a big deal.
Wow.
And that's 15 minutes twice a day, then 20 minutes twice a day. And then I start walking with walking sticks at the hospital, studying my colleagues. Then I'm walking with 1 walking stick and then with none. And then, in April, I tell Jackie I'd like to try riding my bike, which I've not done in 6 years. And she says, well, honey, if things keep going well, maybe we can do that in the fall. So 2 weeks later, it's Mother's Day, and I really want to try riding my bike. So we have an emergency family meeting, and Jackie tells my son, who the 6'5" 16-year-old boy, Zach, you run alongside on the left. She tells my daughter, who's 13, you run alongside on the right, and she'll follow. So we all get in position. He says, gives the all clear. I push off, and I pedal around the block. Now that big 16-year-old boy, he's crying.
Aww.
13-year-old girl, she's crying. Jackie's crying. And when I relive that moment, there are still tears in my eyes, because that's when I realized that the current understanding of secondary progressive multiple sclerosis is incomplete, and who knows how much, what might happen, how much recovery might happen. So I biked a little bit every day. And then in October, Jackie comes home and says, honey, I've signed us up for the Courage Ride. It's 18.5 miles. However far you go, we'll be fine. And the first I'd gone at that point was 8 miles. So this was a big deal. And in fact, I did make it. I did cross that finish line. Once again, we're all crying. My kids are crying. Jackie's crying. I'm crying. And this really fundamentally changes how I think about disease and health. It will change the way I practice medicine. It changes the focus of my research. And I've made it my mission to teach the public that there's always things that we can do to make our circumstances a little bit better. And to teach other clinicians like yourself how to use these principles in their practice, and to teach the public there's so much that we can do. So much that we can do. And, you know, and I also do research. We've done many trials, and our papers are getting noticed. I'm being nominated for award after award. We'll see what comes this year. But, you know, I'm trying really hard to build the research that will let us, with confidence, in all of even the conventional specialist world of neurology and the other autoimmune specialists, that they'll say, yeah, we have these FDA-approved drugs, and they're very helpful, but just as important are all these other environmental factors that we need to have you address.
What an amazing story, very emotional, and it's like a miracle, but it came true. So now you're involved in this study, you're doing so much study and research. Let us know a little bit about your study and what does that involve? Do you have medications or drugs used in this study, or is it?
The very first study that we did was a replication of what I'd done for myself. In others with secondary and primary progressive MS, we did supplements, we did the modified Paleolithic diet, we did a mantra-based meditation, we did exercises targeting, you know, your legs and core muscles, and we did electrical stimulation of muscles. So we're asking people who are severely disabled to do a whole lot, and they did it, and we had remarkable reduction in fatigue, improvement in quality of life, and half of these folks had significant improvement in walking, which is remarkable with progressive MS, because you would not expect them to improve. You would expect them to continue to decline. And so we did 2 studies like that. Then because I couldn't get funding, I kept trying to get funding to replicate that, and ultimately we started doing trials that were diet only, and so we've done several of those studies, published very positive results. The current study is really one of the largest, longest randomized controlled trials of diet in the setting of multiple sclerosis. So we're going to compare, or actually we're actively doing this. We're comparing a modified Paleolithic diet, a time-restricted olive oil diet, to usual diet. People will come in, we do a bunch of questionnaires about your fatigue, quality of life, and mood. Then we do clinical assessments of walking, hand, vision function. And then we also do a no contrast MRI of the brain, so we have a good sense of brain structure. Randomize you, get you trained on the study diet, bring you back in 3 months to repeat the assessments, but not the MRI, and then bring you back at 24 months to repeat all the assessments, including the MRI. We're still enrolling and randomizing. I expect that we will complete our enrollment sometime in the month of July, because we'll have basically about 160 people in the study. And because we're following people for 2 years, this is very much a real world study. It will be very impactful. Whatever it is that we find will be huge, because we have brain MRIs, and we'll have saliva to look at the microbiome. We'll have blood to look at the metabolites in the blood. So we'll understand the mechanisms, molecular mechanism of what's changing as people change their diet. We're very excited. It will be a spectacular study. And so I hope your followers will be open to screening to see if they're eligible.
Some of them actually, they're asking question how they can qualify, or what are the criteria that they have to then get chosen and get into the study.
So you have to be 18, between age 18 and 70, so you need to be an adult. You have to be willing to have relapsing remitting multiple sclerosis. We exclude people if they're in the progressive MS phase, so we're not able to put you in this study. And there are a few other medical things that we will exclude for, but basically, if you're an adult, you speak English, and you'll live in Canada, the United States, or Mexico, and you're willing to come to Iowa at month 0, month 3, month 24, you can be in the study. Now, other folks with, say, progressive MS, I want you to screen so you can be part of our patient registry. Because people in our patient registry, we notify those folks about the various studies that we do that are survey only based. And some of those you could be in, outside the United States, in other parts of the world. I saw somebody said, I'm in California, can you come? Yes, so go to terrywahls.com/MS study, and you complete a little survey, clarifying, do you meet eligibility criteria? And we'll also invite you to be part of our patient registry to hear about other studies. So hopefully everyone will screen so you can be in our database, so you can hear about other future studies that we're doing. And hopefully some of you guys will screen, be eligible for the study, and come, because it'll be super exciting to finally hit my recruitment threshold, and to know that we got everyone. Because getting 160 people into the study in basically a little over 2 years is extraordinary. It means that we'll have all of our data probably sometime in July or August 2026. That'll be super exciting. Then you go through a process of cleaning and analyzing the data. And so in 2027, my team and I will be going around the country to some of the scientific meetings, presenting the research findings, and then getting a publication out probably in 2028. So doing research is a marathon. It's an endurance sport. It's not a sprint. You have to be willing to have a long vision, a lot of perseverance to get it to happen. And then but on the other hand, it is so exciting, changing the world. It is so exciting building the evidence. It is so exciting to see our people come in and be excited to know that they are part of changing the standard of care. We anticipate that all 3 groups will improve because I so we have our 2 intervention groups: the paleo diet, the ketogenic diet, the usual care diet. We give them tips every month on things they can do to improve their diet. And my anticipation is they're going to improve their diet, because if you're agreeing to be in a diet study, it's because you agree that food is important, and that always in our control studies, we have the usual arm, and we give them tips on how to improve their diet. They too are improving their diet. Now, we use the tips from the dietary guidelines on how to eat more vegetables and reduce your processed foods. And we give clear guidance to the paleo group, how to do the paleo diet. We give clear guidance to the ketogenic group, how to do the ketogenic diet. It'll be super exciting to see the results. It's super fun to see people come in.
You have 2 different types of diet in your study. There is keto and it's paleo or modified.
Right. Yeah, the keto is much higher in fat, of course, lower in carbs. And we also added a time restriction so that there's a 6 to 8 hour window to eat. So people often skip breakfast, have lunch and supper, and that seems to work out pretty well for them. The paleo diet folks can have meals 3 times a day.
Very interesting. So they go through this study and they follow you at the 0, 3, and 24 months.
Correct.
And in between, they have any support, or they can contact you, or?
So the intervention arms, they get trained by the dietitians on how to follow the study diet, and then they can communicate with the dietitians for questions, and they can submit questions, which I answer. I create a video answering the questions each month for the 2 intervention arms. The usual diet arm, they get tips from me and my team out via email and text once a month on here are things you can do to improve your diet, but they do not have dietitian support. And what they're getting really is usual care plus monthly scheduled tips on how to improve their diet. We give them little recipes, sometimes little videos, and little blurbs on some research findings to support improvements.
Great. So at some point, we're hoping and aiming so people can come off the medications and drugs.
So what in the clinical trial, we want everyone to stay on their current treatment from whatever their specialist is providing them.
Yes.
In clinical practice, if somebody comes to me and says, look, I'm wanting to ideally get off these medications, my advice is, first we have to keep you on the medicines, use our functional medicine approach to optimize your environment, optimize things for your cells, and see what happens. And as you are feeling better, and depending on the autoimmune disease, that might mean less GI distress if it's inflammatory bowel disease, less pain in your hands if it's rheumatoid arthritis. If it's multiple sclerosis, a MRI that is quiet, no enhancing lesions, no relapses, feeling good. And we've had a year to 3 years of no disease activity. Then we talk about transitioning from perhaps a highly effective drug to a less effective drug with fewer side effects. And then eventually many people are able to get off medications. That's a 2 to 4 year journey to do that gradually, slowly, and very safely. If you abruptly stop your disease-modifying treatment, it's catastrophic. You'll get a rebound of your autoimmune disease. If, on the other hand, you work in the functional medicine approach, very slowly optimize your environment, you're feeling better, the markers of disease activity go slowly down, then you transition from your current disease-modifying treatment to one that has fewer side effects, and eventually off. Again, it's like the endurance sport. It's not a sprint. You want to do everything very slowly and carefully to keep the environment for your cells finely tuned.
So you mentioned diet, of course, is a very key and very important part of this, but what about other lifestyle modifications and how other things are important, like one, of course, stress?
Absolutely. So certainly in my clinical practice where I'm able to manage everything, then we talk about sleep, we talk about stress management, I talk about exercise and the concept of hormesis, mild to moderate stress, followed by a recovery time. So we talk about temperature, heat and cold. We talk about exercise. And for some people, we can do all the environmental stuff immediately. For many others, we have to gradually pick one area of focus at a time, that I'll improve. And I'm very, very mindful that it needs to be at the pace that my patient and and the whole family can manage. And I saw some questions about, so where's my trial? It's here at Iowa City, Iowa, which is, about 4 hours away from Chicago. People usually fly to the Cedar Rapids airport and come to our clinic that way. Again, Iowa City, Iowa, month 0, 3, and 24.
Mm-hmm. So so apart from multiple sclerosis, you have other research and studies going on at the same time too, fibromyalgia.
So,
Mm-hmm.
so we have a study on fibromyalgia, another study on long COVID. And if you want to learn more about those studies, why don't you email MS Studies at MS Studies at healthcare.uiowa.edu. We'll have more information about those other studies probably in a couple of months on my website.
Great. That is great. So diet, and of course we keep hearing about gut health, microbiome, as well as mitochondria. So do you support those during this trial, and any supplement recommendation as well as diet?
Excuse me. So during the study, it really is just focused on diet. In my clinical practice, yes, we would have influence. Excuse me. I have a little viral thing going on, so that's why I have a little more cough.
Oh. So there are some supplements as well recommended, but not during your study, not in the main study. Is mainly working on the diet and lifestyle.
The main study is mostly about diet.
Mm-hmm.
Certainly in my clinical practice, we're going to have supplements. We'll talk about sleep, stress,
Mm-hmm.
exercise, toxin exposure.
Mm-hmm.
So we try to get people to address as much of their environment that they can at the pace that they and the whole family can manage.
Yes, for those people who have not access or cannot register in the trial, of course, you can find Dr. Terry Wahls easily website, on social media, and she has a book. You can start reading her book, The Protocol, which is so much information and very useful for those people.
Yeah. So certainly follow me on Instagram. You'll get little glimpses of my garden, of what I'm eating and doing, some inspirational stories. And then you'll see the types of supplements and products that I use personally to support my healing journey.
You do, I've seen that you do recommend or like to do some cold plunges, ice plunge, and mitochondria.
I love
fasting recommendations. So what is the typical fasting or intermittent fasting recommendation?
So I'll tell you my typical day. I will get up about 5:30. I do a morning meditation. Mm-hmm. I go do my workout. Then I do a sauna, red light, near infrared light sauna, followed by a quick sit on my porch. Then I go to take a cold shower, and I get into my day. I also really love to do an ice bath. And when you do the ice bath, that's just a great way to have a really marvelous sleep at night. And then I try to wear an Oura ring so I can track my minutes of sedentary time, low, moderate, high intensity activity. Trying to reduce the amount of time that you're sitting, not moving. You want to try and get up every hour, even just for a few deep knee bends will do really, really good things for you.
Mm-hmm. So lots of physical activity, but it depends. Again, it has to be very individualized depending on each person.
Yeah. Absolutely. I talk to my patients because many of my patients have severe disabilities. Yeah, and so we have to have an exercise program for people who are wheelchair dependent, people who are bedridden, that maintain physical activity will be very powerful for them. Adding electrical stimulation of muscles to the exercise they do will be very powerful for them.
What about for the cognitive health? Do you recommend anything specific for the cognition?
Well, yeah, there are, well, first thing is exercise, really good for your brain. If you're doing exercise that is combined with electrical stimulation, you get more nerve growth factors, great for your brain. If you do motor tasks that combine some having to learn pattern recognition, partner dancing, taekwondo, martial arts without getting hit in the head, juggling, doing puzzles, spatial puzzles, wonderfully good for your brain. Doing other forms of cognitive training that are fun, somewhat unpredictable, on patterns, wonderfully good for your brain. Then, of course, the nutrition, toxin assessment, potentially mold assessments. These are also really good for your brain. We can have healthy aging. We can have mental clarity into our 90s, 100 and beyond if we take care of the environment for the brain. And my goal is to still be doing research at 120, still teaching the postdocs, the medical students, I'll probably have my medical students and postdocs traveling the world doing the presentations. I may still do them via Zoom, but I may elect to not be flying around quite so much when I'm 120. We'll see.
And tell me what advice for doctors who want to learn your protocol and start seeing patients. Do you have any special programs for?
Yeah. So yes. So all of the medical teams, physicians, other allied health professionals, health coaches, we have a training program for you. It's virtual, and we have monthly calls. As a matter of fact, one of our health practitioner calls is this afternoon. It's a wonderful program, and you can learn more about that at terrywahls.com/certification. And again, we'd love to have and train more practitioners because I can't see everyone. I need people all over the globe. So if you're up there in Canada, yes, we want you. If they're in the United States, yes, we want you. If you're in Europe or wherever, we want you. I think we have practitioners in over 30 countries now. So we certainly are working on building the army of health professionals to help the public as well.
Amazing work. Great work. So we don't want to keep you longer, but one piece of advice for people who live with multiple sclerosis or their loved ones, if anything, you can advise them, give them advice.
So have hope that you can recover even from profound disability. I've managed to recover quite remarkably. We have others who are likewise profoundly disabled, wheelchair dependent, who are again walking, again thriving. Always, whatever your health condition, whatever level of disability, there are things that you can do step by step to make things better for yourselves, for you, and for your family.
Amazing. It's great to meet you today, Dr. Terry.
Lovely. Hey, thank you so much.
Thank you very much. We'll stay in touch.
Okay, sounds wonderful.
Lovely day. Thank you. Good day. Bye-bye.